Hello there. I know it's a little late. It's about 12 o'clock Pacific Standard Time. Finally going to talk about non-invasive rhinoplasty, or what's also known as a nose job. I have a lot of patients who have asked me questions wanting to know if they're a candidate for non-invasive rhinoplasty, so I decided this would be a great talk to give. And if there's anybody out there who has questions, feel free to post them while we are doing this broadcast. I am going to go over some typical questions about non-invasive rhinoplasty nose job, and what is it, how the procedure goes, and then what to expect after the procedure, and who is a good candidate for this procedure. So without further ado, I think we're going to start off with the first question. June, why don't you ask me one of our first questions here?
Sure. Dr. Tansavatdi, what is the procedure? What do you do?
So non-invasive rhinoplasty involves using fillers to treat areas that are of concern for the nose, and that might be a large hump, might be some tip work if the tip looks too large or not defined. People like a nice defined tip. We can do that with fillers. Other areas are if somebody's had their nose broken before and the nose is crooked, we can make it straighter with the use of fillers.
And who is a good candidate, Dr. T?
So a good candidate for this would be somebody who does not want to undergo surgery, the downtime, the recovery after a rhinoplasty. People who have thinner skin are going to be good candidates for this as well. So you can see the results very well in the tip of the nose, on the bridge of the nose. Thicker skin patients might not do so well with this. The exception would be if you are an Asian patient and have a low nasal bridge, want to get a higher tip and higher nasal bridge. Those are great candidates for a non-invasive rhinoplasty who don't want to undergo an Asian rhinoplasty, which can be a huge recovery. I like to use cartilage from either the ear or the rib, which can be a long-term recovery for that. So a non-invasive way would be to use fillers, and that can last you 1 to 2 years, and then may need to be repeated in 2 years, but with not as much fillers at that second time. So it's a great option for those patients who don't want to undergo surgery for an Asian rhinoplasty.
Would you need a local anesthesia for this procedure?
So this procedure is great because you come on in, you visit with us for about 20-30 minutes. The procedure is done within that time frame, and you leave with your nose result right then and there. You're able to see it, enjoy it. You do have a little bit of swelling that can happen just the day after, and maybe 2 days after, but that swelling goes down and you're right back to work and seeing your friends and not even having much of a downtime. You could have some bruising after this procedure, usually very minimal though, and yeah, so minimal swelling and minimal bruising.
And how long is the procedure, Dr. T?
So the injection takes about 20 minutes. We do numb the nose with a topical numbing cream. Most of my patients could get away with not using the numbing cream. You can just inject. The fillers come with lidocaine mixed in there, and so that makes it pretty easy to do without much pain, because after the first injection it's quite numb and it's quite comfortable to do the injection. You do check out who you're going to see for these non-invasive injections for the nose. The nose is a very vascular place, so I want to warn my patients as well as anybody out there, when you're looking for an injector, don't just go in to find a med spa and go to someone who has done injections but not on the nose. You need to know that they've done injections for the nose. They need to understand the anatomy. There's a lot of blood supplied to the nose, and you can inject in the wrong location and cause what's called a necrosis or blindness too, as well, to the eye. So it's not a place that I would say, just do a little bit of research and then just go find somebody. This is something that is critical that you find a experienced injector who also does rhinoplasty, because they will know exactly where to inject. All right?
Thank you.
So there you go, and I hope you tune in. We're going to try to do this on a regular basis. Our feed is going to go out every Tuesday around 11 to 11:30. So tune in next week at the same time. All right, bye.